Seniors caution. This pill causes dementia. If you're taking something for allergies or insomnia or anxiety or depression or even your bladder, well then you have to be careful, as some of these drugs may be quietly increasing your risk of dementia. In fact, taking one of these very common pills daily for 12 months may raise your risk of dementia by 50%. A shocking study from the University of Washington revealed that seniors taking certain medications for just 1 year increased their risk of dementia by over 50%. And these aren't rare or experimental drugs. These are everyday pills, ones you might have in your kitchen cabinet or bedside drawer right now. So, in this video, I want to walk you through what these drugs are and how they're silently harming your brain. And by the way, if you have family members that are taking any of these medications, share this video with them, as there's so many people that are quietly damaging their brains and accelerating the onset of dementia without even knowing about it. Don't forget to like this video, subscribe, and tell us in the comments where you're watching from. You probably recognize the name Benadryl. It's been in medicine cabinets for decades. It's what many people reach for when they're battling allergies, can't sleep at night, or even have a stubborn cough. It feels harmless, familiar, reliable. But here's what the drugstore commercials don't tell you. Benadryl, also known by its active ingredient diphenhydramine, belongs to a class of medications known as strong anticholinergics. And that's where the danger begins. Anticholinergics block a brain chemical called acetylcholine, which helps keep your mind sharp. Think of acetylcholine as your brain's communication highway, sending messages that help you think clearly, remember faces, follow conversations, and even control your muscles. Without it, things slow down, memories blur, reaction times stall, confusion sets in. Multiple large studies have connected long-term use of Benadryl with a significantly increased risk of dementia. In fact, taking it daily for just 3 years was linked to a 54% higher risk of Alzheimer's disease. According to research from the University of Washington, here's the shocking part. Many seniors don't even realize they're using Benadryl daily. It's an ingredient in Tylenol PM, Advil PM, and many over-the-counter sleep aids. So what starts as an innocent allergy tablet can quickly become a health time bomb when used frequently, especially for sleep. And while it may help you fall asleep, the quality of that sleep is often poor. You may feel groggy in the morning, more confused than rested, and less steady on your feet, which can lead to falls or injuries. Here's what you can do. Check your medications and see if diphenhydramine is listed. Talk to your doctor about safer alternatives like melatonin, magnesium, or cognitive behavioral therapy for insomnia. If it's for allergies, ask about second-generation antihistamines like loratadine, which do not have strong anticholinergic effects. Don't forget to like and share this video, and stay with us, because the next medication is hiding under a much more innocent name. To the average person, Tylenol PM sounds safe, even soothing. It's Tylenol, a household name for decades, with a gentle promise to help you sleep. What could be wrong with that? The truth may shock you. Tylenol PM contains 2 active ingredients, acetaminophen and diphenhydramine, the same anticholinergic drug found in Benadryl. While acetaminophen is not linked to dementia, it's the diphenhydramine that's the wolf in sheep's clothing. And when it's used every night, the danger quietly grows. Your brain relies on acetylcholine to form new memories, stay alert, and coordinate body movement. Diphenhydramine blocks this, interfering with your brain's wiring. Over time, it can lead to symptoms that look a lot like early Alzheimer's. Research from the University of Indiana showed that daily users of anticholinergics like Tylenol PM had reduced brain volume in key memory areas. Their brains literally shrank, and they performed worse on memory tests than those not using these drugs. And it's not just memory. Tylenol PM can increase daytime drowsiness, leading to falls, cause confusion and disorientation, weaken bladder control, interact dangerously with other medications. Better options: try acetaminophen alone. Use natural sleep enhancers like herbal teas, magnesium, or calming bedtime routines. Discuss with your doctor if long-term sleep issues persist. Like and subscribe. We have more medications to explore, and the next one is another bedtime helper with hidden consequences. Sleep. It's one of the most common struggles after 60. Many people turn to something like Unisom, hoping for a peaceful night. But behind that restful promise lies a hidden danger your brain cannot afford. Unisom sounds gentle. It's marketed as a non-habit-forming, over-the-counter solution. But here's what the label doesn't shout. Unisom contains doxylamine succinate, a potent anticholinergic drug that can cause real harm to the aging brain. Just like Benadryl and Tylenol PM, doxylamine blocks acetylcholine, the brain chemical that keeps your memory sharp and your thinking clear. When acetylcholine levels are suppressed over time, the brain begins to slow down, both structurally and functionally. In a comprehensive study published in Alzheimer's and Dementia, seniors who regularly took anticholinergic medications like Unisom performed significantly worse on memory and reasoning tests. Brain imaging showed atrophy in areas crucial for memory formation, especially the hippocampus. If you're relying on Unisom every night for sleep, your brain could be under silent attack every single time you close your eyes. And that's not all. Unisom can also cause morning confusion, increase your risk of falls and fractures, lead to urinary retention, interact poorly with other medications like antidepressants or blood pressure meds. Healthier sleep alternatives. Melatonin, a natural hormone, can help restore your circadian rhythm. Try valerian root or chamomile tea before bed. Avoid screens at night and stick to a bedtime routine. Cognitive behavioral therapy for insomnia (CBTI) is extremely effective for seniors. Like and share this video with someone who might be depending on Unisom. Let's protect our memory together. Anxiety is real, especially as we age and face the challenges of retirement, loss, and health concerns. For some, hydroxyzine feels like a gentle answer to overwhelming worry. But behind that calming effect lies a chemical side effect that your brain may not bounce back from. Hydroxyzine is often prescribed for anxiety, especially short-term anxiety, itching, and allergies. Sleep troubles, particularly in older adults who don't tolerate stronger medications. What many people don't realize is that hydroxyzine is another anticholinergic drug, and yes, that puts it in the same risk category for dementia and brain shrinkage. When you block acetylcholine again, that critical memory molecule, your brain starts losing its connections. Over time, it becomes harder to concentrate, remember, or even complete basic tasks like balancing your checkbook or remembering a neighbor's name. In seniors, even short-term use of hydroxyzine has been associated with acute confusion, particularly during hospital stays or after surgery. For long-term users, the risks become even more severe, including delirium, cognitive decline, and slower mental processing. Even if hydroxyzine is doctor-prescribed, it's crucial to ask, is this the best option for someone my age? Safer options for anxiety include low-dose SSR therapy or counseling, including free local senior support groups, natural supplements like L-theanine or ashwagandha. After consulting with your doctor, relaxation techniques like guided breathing, tai chi, or gentle yoga. Subscribe for more trusted senior health content. The final medication we're exploring is for bladder issues, and it may be the most surprising of all. It's one of the most frustrating things about aging, frequent trips to the bathroom, especially at night. For years, Ditropan has been the go-to solution for overactive bladder and incontinence. But what's good for the bladder may be bad, very bad, for your brain. Oxybutynin is a strong anticholinergic, and unlike some of the others we've mentioned, it directly crosses the blood-brain barrier, meaning it travels straight to the brain and disrupts key memory chemicals. Researchers at the University of California found that older adults taking oxybutynin had dramatically reduced scores on memory and learning tests. Brain scans showed more signs of early Alzheimer's disease, even in those without a family history. Think of your brain like a light bulb. Oxybutynin turns down the brightness, slowly but surely. And most users never know it's happening until it's too late. Not all bladder medications are equal. Mirabegron is a newer drug that doesn't block acetylcholine and may be safer for your brain. Pelvic floor therapy and bladder training can help reduce symptoms without medication. Avoid caffeine and spicy foods that trigger the bladder. Like this video and share it with someone dealing with bladder issues. They may be unaware of the cognitive cost. Dear friends, the choices we make every day, even small ones, like taking a pill, can shape the future of our minds. Dementia is not always inevitable. Sometimes it's preventable. And sometimes it's hiding in our medicine cabinet. Let's recap the medications we've covered. Benadryl, Tylenol PM, Unisom, Hydroxyzine, Ditropan. Each of these has been linked to memory problems, brain shrinkage, and an increased risk of dementia, especially when used frequently or long-term. But the power is in your hands now. Ask your doctor, review your medications, explore natural alternatives, choose wisely. Share your journey in the comments. What changes are you making today to protect your brain? Hit like, subscribe, and tap the bell icon because your health journey matters. And we're here to walk it with you every step of the way.